At 50, you are in the prime of life. You feel good and healthy. The topic of health becomes more and more important over the years, and this includes cancer prevention. Colon cancer is a very common cancer. It often grows in the colon for many years. At an early stage of its growth, the cancer causes absolutely no symptoms, and we therefore usually don't notice it at all. At this early stage, the precursor, so-called polyps or early forms of cancer, can already be detected with targeted examinations. If the precursors are removed, cancer cannot develop in the first place. If you already have colon cancer but detected early, it can be treated much better and we can get healthy again. Because colon cancer prevention is so important, most Swiss cantons offer their population over the age of 50 a cantonal screening program. As part of the cantonal program, you can choose whether you want to have a stool test every 2 years or a colonoscopy every 10 years. In the cantonal program, 90% of the costs are covered by the health insurance company without taking the deductible into account. Both examinations offer good prevention against colon cancer, and you can weigh up the advantages and disadvantages for yourself. Only if you have close relatives, for example parents, siblings or children with colon cancer, a colonoscopy is clearly recommended. The advantages of the stool test are that you can do it easily and conveniently at home, and it is very inexpensive in the program. If the stool test is repeated every 2 years, it detects early forms of cancer just as reliably as a colonoscopy. The colonoscopy is a little more complex and is carried out in a practice or in the hospital. However, the colonoscopy can very reliably detect early stages that can be removed directly. If you have not yet received an invitation, order one now via the website. The invitation contains your personal reference number, which is needed for registration. Are you still unsure how to proceed or which test is suitable for you? Your pharmacist or your family doctor will be happy to advise you. You can order the stool test yourself or from the pharmacy or doctor's office. The test kit will be sent to your home by post. Send a stool sample to the laboratory using the enclosed reply envelope. The result will be sent to you by post after a few days. If blood is detected in the stool test, a colonoscopy should be performed. To do this, ask your family doctor to refer you to one of the participating gastrointestinal specialists. Colonoscopy after a positive stool test is also reimbursed free of charge in the cantonal program. Make sure to tell your gastrointestinal specialist that the test should take place as part of the program and not outside of it. A normal stool test should be repeated every 2 years. You don't have to think about anything. You will receive a stool test kit again promptly after the 2 years. If you decide to have a colonoscopy, then register yourself online for your preventive examination. A registration confirmation will be sent to you by email. Take this confirmation with you to your family doctor and have them refer you to a gastrointestinal specialist. Some gastrointestinal practices also accept self-referrals. The colonoscopy is carried out on an outpatient basis in the practice or in the hospital. The gastrointestinal specialist will tell you the result immediately after the examination. If the colonoscopy is normal, we will invite you back promptly after 10 years. Test yourself before you feel any symptoms. Join in.